Brain cancer remains one of the most devastating diagnoses, and glioblastoma multiforme, GBM, is among the deadliest forms. With a median survival time of only 12 to 18 months despite aggressive treatment, patients and their families often face a grim reality. A new clinical study has provided a glimmer of hope, suggesting that the ketogenic diet may significantly improve survival rates. However, before embracing this approach, it is crucial to acknowledge the limitations and challenges surrounding this research. The study followed 18 GBM patients and found that those who maintained a ketogenic diet for at least 6 months had a 66.7% 3-year survival rate, compared to just 8.3% among those who did not. While the numbers are striking, the sample size was extremely small, making it difficult to draw broad conclusions. Additionally, adherence to the diet proved to be a major obstacle, with only 1 out of 8 women successfully following the regimen. This raises concerns about whether the diet is a realistic option for most patients, particularly those already struggling with the physical and emotional burdens of cancer. The ketogenic diet is based on drastically reducing carbohydrate intake, forcing the body to rely on ketones rather than glucose for energy. Since GBM cells depend heavily on glucose, the theory is that depriving them of their primary fuel source could slow tumor growth. There is also evidence suggesting that a keto diet may reduce inflammation and enhance the effectiveness of chemotherapy and radiation. While these mechanisms are scientifically plausible, they do not guarantee success for every patient. Cancer is highly complex, and individual responses to dietary interventions can vary dramatically. Despite the potential benefits, the ketogenic diet presents significant challenges. It requires strict dietary adherence, which can be difficult for patients undergoing intensive cancer treatments. Many struggle with nausea, loss of appetite, and fatigue, symptoms that make major dietary changes even more challenging. Social and family pressures can also play a role, as some relatives may discourage alternative approaches in favor of conventional medical treatments. Financial barriers must also be considered, as high-quality keto-friendly foods can be expensive, adding stress to families already burdened by medical costs. It is also important to recognize that the ketogenic diet is not a cure. The patients who followed the diet did not eliminate their cancer, they simply survived longer than those who did not. While any increase in survival time is valuable, it does not change the aggressive nature of GBM or eliminate the need for traditional treatments. The diet should be viewed as a complementary approach rather than a standalone solution. Further research is desperately needed before the ketogenic diet can be recommended as a standard component of GBM treatment. Larger clinical trials with diverse patient populations are necessary to determine whether the survival benefits seen in this small study hold up on a larger scale. Researchers must also explore why adherence rates are so low and whether the diet can be modified to make it more practical for cancer patients. For those considering the ketogenic diet as part of a cancer treatment plan, it is essential to consult with medical professionals. Attempting such a restrictive diet without proper supervision could lead to nutritional deficiencies and other health risks. Patients should weigh the potential benefits against the challenges and determine whether this approach is realistic given their individual circumstances. While this study provides a hopeful signal, it should not create false expectations. Cancer treatment remains complex, and no single dietary change can replace the need for comprehensive medical care.